Hi, and welcome to the show. Subscribe at kevinmd.com/podcast to get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Ruhi Saldanha. She's an undergraduate student. Today's KevinMD article is A Teenager's Perspective, the Pressing Need for Mental Health Days in Schools. Ruhi, welcome to the show.
Thank you.
I actually don't talk to a lot of undergraduate pre-medical students on this podcast. So you wrote about the pressing need for mental health days in schools. So tell us what led you to write this article.
So, my senior year of high school, I did an internship under Dr. Kenneth Mendel at Harvard on kind of looking at some teenage mental health statistics and things like that. And that kind of exposed me to the fact that there's not really enough kind of focus on adolescent mental health. And it is a big problem in the United States because there are rising rates. And in my article, I talked about how Illinois itself has 5 legally instituted mental health days for their students built into the education system. And that's only 1 out of 12 states in the United States that have this, which is only 24% of the United States. And that is a big issue because, mental health is important, and kind of having that focus on it is what led me to write the article.
All right. So tell me from your perspective, you're a freshman in college. What would you say are some of the root causes that's causing such a mental health crisis in teens?
Yeah, I think that there's a lot of pressure, especially for, high school students with dropping college admission rates and also, the societal pressure that comes with being a teenager. And even in college, it's kind of difficult because it's a big adjustment being away from home, or however students are, like, even if you're not living at college or things like that, like it is a big adjustment. And I think that all that kind of contributes to, the mental health issues that students may have.
So during your last year of high school and your first year of college, what kind of resources were available to you in case you needed to talk about mental health or any behavioral health services that are available to teens?
Yeah, I think I was very lucky in my high school that I did have social workers and counselors that I could go see. And UNC, which is the school that I go to, has also instituted mental health days. So that is a very nice resource for students. But I think a lot of kids across the country don't have the same resources that I had. And that is a big problem. Like having those social workers, counselors focus on why mental health is important, and having those resources is something that a lot of students don't have.
So
So
mental health, of course, is such a broad umbrella. So in terms of the specific symptoms or conditions that teens are facing, what exactly are they?
that's a good question. I think, you can kind of tell with a lack of motivation, and a drop in schoolwork is a very big indicator of, having some outside issues, which could include mental health and things like that, like not wanting to socialize, drop in performance in school, kind of erratic behaviors, because a lot of mental health issues, and I've seen this in myself, my peers, and stories from other kids across the United States, that mental health or poor mental health can be a gateway to a lot of violence, drug use, substance abuse, which in the United States, every year over 100,000 kids die of substance abuse issues or have used substances as kind of a way to cope with, lack of having mental health resources, which is kind of a big contributor to why we need more mental health resources in schools.
So in terms of substance abuse among your peer groups, is that something that you've seen personally in your high school or college?
Yes, I think both at the high school and college level, I have seen a lot of issues with substance abuse in my fellow peers, which I think there definitely needs to be more awareness around the dangers with this, because especially as fentanyl rates, overdose rates rise in the United States, like it is really dangerous for kids to be using these substances, and it definitely is prevalent across the United States.
What about things like medications for attention deficits or stimulants? I read articles that teens are using these to help focus and help studies, even though they don't have a clinical diagnosis of ADHD. Is that something that you're seeing?
Yes, definitely, especially in the college environment, since it is such a fast pace and it requires students to be very focused on what they do. A lot of students do feel the need to take attention deficit, like medications to help attention deficit disorders, like Adderall, for instance, which is very big on campuses. And honestly, like it is a very big problem.
And again, is this something that you're seeing personally among your peers?
I have seen it among my peers, and I bet that they're across the United States. It's the same way.
So you mentioned in Illinois, they have the availability of mental health days. So tell us exactly how that works.
Students are allowed to take 5 mental health days whenever they need. So this is kind of like a no questions asked day off for students to take a break from work, focus on family, other priorities, which I think is great because it lessens the feeling of being overwhelmed in school. And then also, if they're going through something outside, that kind of eases their feelings a little bit because it gives them time to themselves. The UNC has 4 instituted
Hmm.
mental health days, 2 per month. And that allows students to have that time to themselves. And many people go home, go see their family. So,
Do you see a lot of your peers? Do they take advantage of those mental health days?
yeah, definitely. I think that a lot of my peers and I both benefit because it allows us to, instead of having everything kind of become very overwhelming, especially in the college environment, which requires a lot of focus, having those sanctioned days off definitely helps. And I I live in Chicago, so I don't really get to see my family a lot because I'm out of state for college, and being able to use those days to go home or FaceTime my parents, my friends, it's so helpful.
So you're a freshman in college, and my daughter is in the same age as you. She's also a freshman in college. So you just recently went through that whole college application process. So tell us how that whole process may also contribute to the teen mental health crisis.
Yes, I think that college is a very big contributor because those admission rates are dropping, and that can cause a lot of unnecessary stress on students and also comparison. Comparison is a big factor all throughout college and high school, which can contribute to feelings of depression, anxiety, like I'm not going to get into the college I want, and things like that, especially with the course load of senior year, which is kind of like for most kids, it is a very heavy course load because you're balancing college admissions and school and also social aspects of being a teenager. And I think that's a big contributor because there is a lot of pressure to get into a good school or school that you like, and that can cause a lot of issues in students.
Where does that pressure come from? Does that pressure come from parents? Does it come from peers? Does it come from yourself? Where do you feel that pressure?
Of course, every student is different, and I don't want to generalize too much, but I think that there are definitely a lot of different avenues where that pressure comes from. Just like you mentioned, from parents, teachers, friends. I think social media is also a very big contributor to this because with apps like TikTok, Instagram, you're seeing people apply to college, get into good schools, or get into the schools that they want. And there's kind of a pressure that you want to fit in and you want to be like them and be happy in that sense. And I think a lot of the big thing with college is that those college admissions, a lot of students view them as determiners of their success
Hmm.
as people and as students. I think that is a bit of a problem because it kind of causes a lot of unnecessary stress. So it can come from within the student as well.
So you mentioned how mental health days can help, but in terms of getting the root problem, I guess, what other avenues would you suggest to help with the mental health crisis among teens?
I know that I mentioned this previously, but definitely having those resources in the school environment is very important, like social workers and more education on adolescent mental health, even to like physicians also. Both physicians and the students and teachers can really help because when students are aware of what they're experiencing, and also when physicians, parents, teachers are also aware of how they can help the student, I think that can create more of like a connection between those to help solve mental health issues.
So one of the things that you mentioned that caught my ear was that physicians need to be more aware, of course, of the mental health issue among teens. So tell us the questions that you would like us to ask you to best help you cope with any behavioral health issues in the exam room.
Yeah, I know that a lot of physicians have questionnaires, or pediatricians before they see the children.
Hmm.
They have questionnaires that they can fill out, like have you had issues with eating in the past 2 weeks or few months? Have you had times where you feel very, very sad, and how often is that? And I think that those are great questions for, you know, younger children. And I also think that it is very good if physicians would do this maybe without the parent in the room,
Hmm.
because a lot of students can feel kind of, or sorry, a lot of adolescents can feel very ostracized or something like that in their family. And I think that physicians directly asking the teenager or younger child themselves, if they feel very sad often, how often, if they have problems with eating, which is a big indicator of, underlying mental health issues, things like that, for them to become aware and also for the child to become aware.
We're talking to Ruhi Saldanha. She's an undergraduate student. Today's KevinMD article is A Teenager's Perspective, the Pressing Need for Mental Health Days in Schools. Ruhi will end with some of your take-home messages that you like to leave with the KevinMD audience.
Yeah, I would really like to emphasize that mental health is very important, especially in adolescence. Well, for everyone, but especially for adolescents. And there needs to be more resources, more education to kind of combat this issue because it is a very big issue. And I know that Dr. Vivek Murthy, who is the Surgeon General, raised an alarm on rising adolescent mental health issues. And I think that this definitely is a very good start on making people aware around the country. So I just want to emphasize how important this issue is. So yeah,
Ruhi, thank you so much for coming on the show and sharing your perspective and insight.
thank you so much.